Greetings, everyone. I'm Jude Kobsar. I'm here to give you the heavy metal urine test instructions video. You have written instructions in your module, in your Recreate portal, as well as this video instruction. So you can print these out, watch the video, and away we go. So heavy metal testing is to determine if you have heavy metals in your body, and if it is determined that you do through the labs and the lab review that Dr. Kobsar will have with you, then you will be instructed to move on to heavy metal therapy. So this is just the testing part of it. The heavy metal testing is a 2-day test. The first day, you're just simply taking a supplement and looking for sensitivities. The second day, you are actually collecting the urine. So let's just start with day one. And I'm going to read off of these instructions. So if you want to print your instructions out and follow along, that would be awesome. Really important that you carefully read all the instructions before beginning this test, because if you don't do it correctly, the results aren't going to be accurate, and then you may need to retest. So no eating shellfish for 5 days prior to this test. Again, this is a 2-day test. All right, so we're going to go through the kit first. You're going to be shipped a kit. Now, if you are a Recreate Wellness partner, this kit will come in your larger box that has the rest of your nutraceuticals in it. If you are an alumni and you're only doing the testing, you're just going to be shipped this test kit, as well as if you are public and new to Wellness Method, you'll be shipped this test kit. So let's look at what is inside of this test kit. So first of all, to note, you're going to get a bottle of DMSA. So this is called a provoking agent, and I'll go over that in a minute. You will have a collection cup. So this is what you're going to be collecting your urine in. And you're going to be collecting your urine over the course of 6 hours. So you want to plan to be home that day. You're going to be using this larger screw top bag to pour the urine in and hold it over 6 hours. This will go in your refrigerator, and I'll go over that a little bit more in detail. And then there is a form for you to fill out with all of the highlighted areas of the places that you fill out. Just worry about the highlighted areas, nothing else. There is a collection vial that you'll be filling out information on the label of this vial, and this is actually what you're going to be sending in. There are also additional instructions in your kit, but we ask that you do not follow these instructions, that you please follow the instructions that are in your digital portal right here. And lastly, there is a FedEx shipping bag with prepaid postage on it for you to ship your final vial in, which I just dropped. So this is the vial that you're going to be putting in your envelope to ship, okay? All right, so we're going to put everything back in there for now, and I'm going to go over this 1 day at a time. Again, it being a 2-day test. So the first day, you're going to be testing for sensitivities. And the sensitivities are to the provoking agent, the DMSA provoking agent. So the provoking agent is what binds to the metals and drags them out, and then they get excreted through your urine. So on day one, first of all, you're not going to be changing any of your eating. So if you're new to us and you don't have an eating plan, just do what you're doing. If you're an alumni and you don't have an eating plan, do what you're doing. If you're an alumni and you're in the anti-inflammatory phase or maybe metabolic reset, whatever phase you're in, just keep eating that way. If you are a Recreate Wellness partner, this comes in a specific phase of your program. You're going to continue to eat that way. All right, so don't change any of your eating. So day one. Upon rising, you're going to take 1 DMSA tablet. Do not eat for an hour before or after taking this tablet. They're very small, just little white tablets. Okay, you're taking 1 tablet to test to note if you have any sensitivities. Again, you're not collecting urine on day one. You're only testing for sensitivities with the provoking agent. So what to look for as far as what would be a normal thing that you would be feeling after taking one of these capsules? Gas, fatigue, bloating, or diarrhea. So those are normal, okay? If it's excessive diarrhea and you can't leave the house, then you need to email us, call us, report that as an extra sensitivity. But the gas, bloating, fatigue, and diarrhea, that is normal because this is a provoking agent, so it is going to change things in your body. So it's not cause for alarm. Note what you're experiencing. You can write it down and go on with your day as normal. It's not going to affect you. Okay, you may not feel anything. I didn't feel anything when I tested mine out. If you experience anything more severe than what is on this list that I just talked about, then email the clinic, notify us so that we know what to recommend for you on your second day because it will change a little bit. Okay, so email us at partners@mywellnessmethod.com or call us. Phone number is on the instructions. All right, so we already went over what is in the test kit. So that is all you're doing on day one is you're taking that and you're notating any sensitivities. If you don't have any sensitivities, we don't need to hear from you, okay? If you have sensitivities, we need to hear from you. All right, so day two. So now we're on day two. This is the day that we're collecting urine. So you're going to be collecting urine over the course of 6 hours. So you want to plan to be home that day. So don't do it on a day where you have to go to work or you have a softball tournament with your kids or something like that. You want to do it when being at home is easy. Okay, so you're going to be collecting urine over the course of 6 hours. Again, don't change anything with your eating. So, the first thing that you're going to do when you get up in the morning is you're going to empty your bladder into the toilet. You're not collecting this first round of urine. You just get up, go to the bathroom as normal. Okay. Don't eat anything after or before you urinate. And don't take any supplements this day. So, if you're on vitamins, if you're on some other nutraceuticals, some herbal things, don't take any supplements, nutraceuticals. If you're on medications, continue to take medications. Okay. So, if you're again on a multivitamin, on some kind of supplement, protein, nutraceutical shake, any kind of nutrient shake, any kind of supplementation, herbal remedy, don't take it during this 6 hour testing period. If you're on medications, you continue to take the medications. All right, so after your first urination, which is going to be in the toilet, you're going to take your recommended amount of DMSA that is listed on the chart on your instructions. So on your instructions, there's a chart right here, and this is going to tell you how much of the DMSA provoking agent you are taking on day two. Day one, remember, was testing for sensitivities. If you had sensitivities, we're going to adjust what you take. You're not going to follow this chart. If you didn't have sensitivities, you're going to be following this chart. It's based on your weight. So for instance, I weigh between 131 and 140 pounds. Okay, I weigh 139, and my recommended amount is 1,200 milligrams. Okay, so it's on the chart. One tablet is 100 milligrams. So I will be taking 12 tablets at this time in the morning after my first urination into the toilet. 12. I know that sounds like a lot, but this isn't that big of a deal. I took 12. I've already done the testing. It's no problem. Okay. So you're going to take the recommended amount that's based on this chart right here, based on your weight. So if you weigh 171 pounds or more, you're taking 12. If you weigh under 100 pounds, you're taking half of a pill. If you weigh 100 to 110, you're taking one pill. Okay, now these are capsules. So if you're under 100 pounds, you're going to be taking half, which means you're going to actually be opening the capsule up, dumping about half of it out. You can put it in water or something that you're not going to taste it too terribly, but you're going to be taking half of what's in the capsule. Okay. All right. So now that you have that in your body, the next time you urinate, you are going to collect it. Now, the other thing that's really important is that you're drinking a lot of water throughout this entire day. Okay, we want you to completely drink 1 to 1.5 liters of reverse osmosis water or filtered water. Okay, if you have to drink bottled water, that's fine. We never recommend drinking bottled water, but you can drink Aquafina or Dasani. Okay, if you don't have reverse osmosis, if you don't have a water filter. All right, again, 1 to 1.5 liters during the 6 hour collection period. Okay, so now we're going to start collecting our urine. So you're going to go into the bathroom and you're going to urinate into this cup. All right. And then you're going the entire amount. And then you're going to bring this into the bathroom with you. And then you're going to open the screw top lid when you're done urinating, and over the sink, this is how I do it, you're going to pour the urine into this bag. Okay? You're going to put the lid on. You're going to put this bag in your refrigerator. It needs to be refrigerated for the entire 6 hour period. Rinse this out, put it on the back of the toilet, on the counter, take it with you, depending on where you are and what you're doing. This is going to be your collection cup for the rest of the day. So over the course of the next 6 hours, every time you need to go to the bathroom, you are urinating in this cup. You are getting this out of the refrigerator. You're pouring the urine in. You're rinsing this out. You're putting this back in the refrigerator, making sure the cap is on really tight. Okay, so that's what you're doing over the course of 6 hours. Making sure that you're drinking a lot of water. Your urine may have a strong smell. This is normal. This is due to the DMSA that you took earlier in the morning, your recommended amount. Okay. Now, after completing your 6 hours of collection of your urine, this bag is going to be half full or pretty full, depending on who you are and how it comes out. What you're going to do, make sure that this lid is on really tight, is you're going to shake this bag for 30 seconds. Shake it up really good because we want to mix the urine from this morning and then just the last time. All right, so you're going to shake it up really good. I recommend doing this over your sink in your bathroom. And then this specimen vial, that's what this is called. You're going to pull this out of the baggie, and you want to save all this because you're going to need it. Okay, save this little bag. You're going to pour the urine into this specimen vial and only up to this line. Okay, so you're going to take the lid off of this and you're going to take the lid, of course, off of this, and you're going to pour your urine in here very gently, very slowly, only filling to the line. All right, you're going to cap that. You're going to take this and you're going to dump it down in the toilet and get rid of it all because you're done. Okay, once you fill the specimen vial with your urine, you're done with this. Put it back in the toilet, flush the toilet, just close this up and put this in the recycling. Okay, so you're done with this bag. Okay, all right, so next, here we go. Make sure that this is nice and clean and dry. You're going to fill in the blank spaces on the specimen file. So patient name, date collected, date of birth, and pre or post. It's already marked that this is post, meaning that this is after you're taking DMSA. That's what post means. So you don't have to worry about that. Just fill in the blanks on here. Okay, so this is your specimen vial. You want to use a Sharpie to do this. Okay. All right, so you are going to take this little paper towel that they provided for it, wrap it around there, put it back in the specimen vial. It will absorb the condensation, and you're going to put this in your cardboard box that you received everything in, and this is going to go in the refrigerator after you fill out your form, which we're going to go over next. Okay, so this is the urine that is going back to the lab. All right. So this is your test requisition form. You're going to fill out everything that is highlighted. So it's super simple. Everything that is highlighted, that's everything on the front. There is nothing that you need to do on the back. Everything is on the front, okay? And it's highlighted. So that is going to get put in your box. Okay, now you're ready to ship. So there's the FedEx envelope that's in your kit. There's a prepaid label. There's a space right here for you to write your name and your address on this label. And you're going to fasten this label to your FedEx envelope. What you're going to put into this FedEx envelope is the entire box that now at this point contains your vial, which is full of your urine, and it contains your requisition form that you filled out. This has been kept in the refrigerator since you finished your testing. You're going to close the box up, and you are going to put the entire box inside of your FedEx envelope. Okay, and that is what gets shipped. So the entire box that has your urine specimen in it goes in the FedEx envelope, seal it up, make sure this is on it, and you're ready to go. That is what you take to get shipped. All right. Couple things here. Once we get your lab results back from the lab, we will email you or call you to set up your lab review for your heavy metal results. Also, Once you have finished your test, you need to wait 7 days if you plan to give blood or get a blood draw for another reason, because you have this in your system and we need to wait till that gets out of your system. So wait 7 days before giving blood or having your blood drawn. Also, do not dispose of this, because if you show heavy metals in your system on the lab review, you will be doing a heavy metal therapy to draw those heavy metals out, and the DMSA is part of that therapy. Okay, so that's it for sending your urine sample in, for all of the instructions that you need. Remember that everything is in your portal. These instructions are in your portal, and we're excited to continue to work with you and continue to witness your progress and your transformation in your Recreate program.